Thank you, Madam Chair, and thank you very much for holding this hearing, and thank you, Ranking Member. Last week, I was at the Manic Community Health Center in Quincy, Massachusetts, and the week before that, I was at Lynn Community Health in Lynn, Massachusetts, and talking to physicians and first responders and patients and local officials about how this public health care crisis has devastated communities and families across our Commonwealth. According to the Massachusetts Department of Public Health, an estimated 2,000 people in our state died from opiate overdoses just last year. And as the chair and the ranking member have noted, thousands of children are affected, and many are left in the care of their grandparents. And I've seen the data on this, that children whose parents struggle with substance abuse disorder are about twice as likely to develop the disorder themselves. So where I wanted to start this was a variation on the question that Senator Casey just asked Dr. McDaniel, and that is about resources and connections. But this one is about when you suspect a substance abuse problem. Ms. Limp, can I ask you, if grandparents become concerned about a grandchild's substance use, are there good options for them to access treatment or counseling in their own communities, maybe through a pediatrician, that grandparents are readily familiar with?
So again, those that are already connected to the child welfare system would probably turn to the social worker at the child welfare system for that information, but the vast majority don't have that resource available to them. So best case scenario, they live in a community that has a kinship navigator where they would have a one-stop shop answer to those questions. But those are also not available in most communities right now. We'd like to see them. So I would say the vast majority of families in that case are going to look to the physician that they're connected with, probably their child's pediatrician. So it would be very important that that physician is familiar with issues of substance use and how it affects children when they're exposed and when their families are dealing with that crisis, and to coordinate those services. Those that may not even be comfortable talking to their physician are going to look to their peer network. And that's why support groups and other types of services that some of the agencies represented here are really important, because that peer-to-peer communication and where to go to support is really critical as well.
I understand that, and I think that's really important. Did you want to add to that?
Yes, thank you. There are some really exciting models, I think, related to your question that they're nicknamed, or their acronym is SBIRT, but Screening, Brief Intervention, and Referral to Treatment models, where you train a variety of practitioners, everywhere from nurses to physicians, to be able to screen people where they are and then make those referrals in their communities for substance abuse treatment. And I think I'm in a rural community, and I think those types of resources are so important, because people will go to their doctor to talk about what's going on, but they may not necessarily access a substance abuse treatment facility.
Right. And your point gives me a chance to talk about one in Boston, but it's the reminder how many different kinds of services may be needed when it's time to intervene. The Adolescent Substance Abuse Program at Boston Children's Hospital brings together whole teams of pediatricians, social workers, child psychiatrists. They work on screening, they work on diagnosis, they work on treatment for adolescents who have substance abuse disorder. And the idea is to do this hopefully at a time when they can keep children both at home and in school and try to work through these problems. And the program partners with pediatric practices throughout the region so that local doctors can get engaged in this. And I take it from your comments and from everyone nodding their heads about this, that this is an important thing for us to expand, that this is the kind of thing that we should try to make available throughout the country, so someone's got a way into this. I want to ask another part about this, and that is, when grandparents are trying to get substance use disorder diagnoses and treatment, both for their children and for their grandchildren, or for either, how important is health care coverage to providing access to preventive screening and to specialty care? Ms. Lent, could I ask you about that?
Again, I would say it's critically important. I conveyed earlier that often when they don't have access to other services, they still have access to Medicaid for the children, and so that's a critical resource to them. Again, but they need to be aware of it, so things like kinship navigator programs and resources that can connect them to those services are important, but the healthcare is foundational.
Right. And if the cost of health care goes up, or if Medicaid is sharply cut, what will be the impact? Ms. Hoxie, maybe would you like to speak to that?
Well, I can certainly speak on a personal note. I mean, if I didn't have it have medical coverage for my children, I can't even imagine, what it would be like. And certainly for the families that I work with. I can give you one example of
Please.
a family that lived in a rural area in Maine, and the grandmother was caring for her son who was addicted, his child. I don't know where the mother was in all of this, and her husband was ill. The son eventually overdosed and died, leaving grandmother with, oh my gosh, how do I meet the mental health needs now of this grieving child? 2 weeks later, her husband passed away. So, glad that was a recording. She was, looking everywhere to find grief counseling. And in the area that she lived in, there wasn't anything that was going to be available for 16 weeks. So I don't know if that answers your question, but going without it, was devastating. And they did eventually find somebody that would work with them individually. She wanted someone that would work with them as a grieving family and with a child with some significant mental illness himself at this point.
I appreciate that, and I see you all nodding on this one. The Affordable Care Act made it possible for many families that are struggling with substance abuse to get access to the care that they need. And if the mental health and substance abuse disorder protections of the ACA are cut out, the estimate is that there would be $5 billion in resources taken out of this area, which would make it a lot harder for families to get their lives back on track. So this is something that I appreciate your talking about, and a reminder of how much we need to do to make sure that we're trying to support families that are struggling with this terrible epidemic. Thank you, and thank you, Madam Chair.